Okay. Hello, everyone. Let's wait just for a minute till more people join in. Okay. Let's begin. A warm welcome to all of you. Hope you are doing well. And today's topic is about food and medications. So we'll be talking about certain drugs which interact with food, also some nutrients which interact with each other, or what is the effect of food on medication and vice versa. So that's the topic for today. I will be sharing a PPT and take you through it. Any questions you have, you can post it after the session when we open up the chat. Do put in your queries there and I'll be happy to answer them for you. So let's begin. Let me share my screen. Okay, let me minimize this. So what are the foods that we have to eat and what are the foods that we have to avoid when we are taking medication and vice versa is the topic today. And just to introduce myself, my name is Alpa. I am a senior nutritionist as well as heading the research department here in HealthifyMe. Let's begin. So when we talk about food-drug interaction, or what is the effect of medication, like is the medication going to work for you or is the medication not going to work for you? There are many factors involved, right? So depending on if that medication is working for you, it depends on your age, it depends on your weight, it depends whether your gender as well. What is your medical condition, right? Is that medication going to affect you? Also the dosage, if you're taking the correct dose. The specific example I can give is thyroid medicine. Your doctor needs to titrate the dose of thyroid medicine so that your thyroid hormone is controlled, right? Plus medicine taken with some other medicines, are they working together or not? Sometimes they counteract each other, so you have to be very careful which medicine you have to take, right? And the doctor is the right person who's going to advise you. Plus there are also the medications, and along with that what supplements you are taking will also affect on the absorption or the action of that medication, right? So there are so many factors involved when we talk about medication. And the right person to give you the advice is a qualified doctor. However, I can definitely talk about food and the interaction of that food with a medication, or the interaction of medication on a food. So we'll be talking about two things today: a drug nutrient interaction, that means the effect of a medicine on food or the nutrients in food. And the second is a food drug interaction, that means the effect of food or nutrient on medication, right? So both ways. So many a times what happens is food can either prevent the medicine from working the way it should, or the supplement from working the way it should and cause some side effects, right? But at the same time, food can also help that medication to work much better for you, right? So food has both effects. It can either give a positive effect, it can give a negative effect. So it's always good to know that which food you should eat and which food you should avoid, right? The main reason why you need to do that is so that there are no nutritional deficiencies, you get the medication can work properly, and at the same time also you want to benefit from whatever you are taking, right? If it makes it worse, then you have to avoid eating those foods. So if you know about that, you'll always be careful as to what you have to eat and what you don't have to eat. Sometimes the side effects that can occur can be very dangerous, and we'll be talking about quite a few examples which can be very dangerous. So always good to know what these foods are and with what medication you don't have to take. Now, having said that, the most side effects are often seen in people who are poorly nourished, right? Whose diet is not great, whose diet is not giving all the nutrients, who it is very compromised, and also people who have existing conditions which are chronic in nature, probably diabetes, hypertension, heart disease, then cancers, all of these. If you have chronic conditions or autoimmune diseases, it is definitely going to affect much more than a normal person who may not see much of these side effects, right? So always keep that in mind. If you fall under these categories, then it is definitely something that you would really need to look into, right? So now, what are the effects of food on medicines, right? It can be these multiple categories that I have. Either it can affect the absorption of the drug, right? So when you eat a particular food or a nutrient, it can either let that drug be absorbed properly, or it can not let the drug be absorbed properly. So how it can does is, when you eat food, it is broken down into your stomach and then in your intestine. So in that process, it can bind to some of the drugs and some of the medicines, and it may either not let it get absorbed, or it may help by staying there and absorb it, help it get absorbed better. Also, what how food can affect is to break down that particular drug. So either the food may help that drug to be broken down and get absorbed, or it may not help to break down, right? So again, two ways. Then excretion means whenever we take medicine, that medicine, whatever particles are remaining, or the drug which is drug residues which are there, has to be thrown out by our kidneys, right? So certain foods can help us throw out these residues faster, and certain foods can help proper absorption from the kidneys, and whatever residue is there should be thrown out, right? Also, sometimes food can help enhance a particular drug, right? For example, vitamins, minerals. Then the classic example I can give is tea and coffee. Like tea and coffee can actually not, it will not help certain drugs be absorbed. And alcohol, I think alcohol is one thing which leads to malabsorption of many medications. In fact, when you read the medicine, or your doctor will often tell you that do not have alcohol with this medication. So I think alcohol is probably the number one constituent which is definitely going to affect the absorption or the efficacy of a particular drug. Now, when we talk about drug on food, we spoke about food on drug. What about drug on food? So same way, like how we spoke about foods can help absorption or inhibit absorption, breakdown, and excretion. Same way, drugs can also affect the nutrient absorption, breakdown, and excretion. Like certain drugs may either not let that nutrient be absorbed, or it may increase its absorption. Certain drugs may break down a nutrient, and that's why helping us get more of that nutrient, right? And certain drugs may lead to excretion of that nutrient, or certain drugs may hold on to that nutrient in our body and cause some side effects. So these are the ways that food and drug can interact with each other, right? So now let's talk about the drug nutrient interaction first, and then we'll talk about food and drug interactions. Okay, so the drug and drug nutrient interaction, when I'm talking the word drug, that means medications. Now these medications can either be the one which your doctor has prescribed, like your thyroid medication, heart medication, blood pressure medication, or it can be over the counter, which when you can buy from the pharmacy, like it can be painkillers, it can be cough medication, antacids, which doesn't need a prescription, right? So medications can be either of these, right? Now, one thing for everyone to know is, if you've been taking medicine for a very long period of time, then it will definitely lead to the deficiencies or whatever I'm going to talk about in the further slides. It is much more prominent in those people. Like some people have this habit of popping painkillers for everything. Their leg is paining, head is paining, body is aching. They'll just keep on popping painkillers like candies. And some people have this habit of popping Gelusil or antacids just like that. You feel a little uneasy, thoda sa pet mein kuch ho raha hai, pop in an antacid, right? So a lot of people have this habit that they just keep on popping medications. So such people need to be very aware that by doing this, you are definitely causing your body to lose very vital vitamins and minerals. And we'll discuss about the different vitamins, minerals that you would lose in further slides, right? So what can medications cause? So first category is, it can lead to poor appetite. There are certain medications which can decrease your appetite, or which can cause that feeling of nausea, vomiting, right? So what is the example over here? Cancer medications, okay, and there are certain treatments. Then even certain antibiotics, right? If you take some strong dose of antibiotics, or if you are taking some strong medications for chronic diseases, or you are hospitalized, typically you're always given an antacid along with it, because they can cause nausea. Now that is a medical treatment. But when we talk about food also, if you are suffering from certain illnesses, usually you think that you're not feeling hungry, you're feeling very nauseous. It could be a side effect of medicine and not because of the illness per se, right? So like the example I gave is, a classic example is strong medicines like cancer medications or even antibiotics, especially if it is taken for a very long duration of time. For example, UTI, a urine infection, oftentimes antibiotics don't work, right? So you will be given one antibiotic, take it for 10 days, and then again the infection comes again, and the doctor probably has to put you on another dose. Keep on having multiple doses of these antibiotics, it can definitely decrease your appetite, right? The second example here which can decrease your appetite is drugs which are made for that. There are a lot of weight loss drugs or appetite suppressants which are there in the market, and some example is Orlistat, specifically given for obesity. And there's also this injection which comes, which is also given to control your diabetes, and even to lose weight if you're having PCOS also. A lot of these are prescribed. So what these drugs do is, they target the fat cells, right? And they basically, they do not let a lot of fat be absorbed, and it goes unabsorbed. So in that scenario, they will suppress your appetite, right? So certain medications can lead to poor food intake or poor appetite, either directly or indirectly. Now, some medications can also lead to decreased absorption of nutrients. These are very important. So please pay attention to these, because these are something which these are the common medications which we use for long term, right? So First example is laxatives. How many people feel that they are constipated, okay, and they just will self prescribe any of these laxatives which are available, either it's Gelusil or Metamucil or Dulcolax, right? You feel constipated, so either the doctor advises or you would self advise because it's available over the counter. So what happens with oral laxatives is, um, when you take these laxatives, right, because it's a laxative, it makes the food very soft and makes it pass very rapidly from your intestines, and you that constipation is relieved. Now because of this, many a times not all nutrients have the time to be absorbed. So how are nutrients absorbed? Very common science thing that I would like to talk about here is, when we eat any food, right, you chew it. So when we chew, saliva is released, and from the saliva there are enzymes which are released, which break down that food, which then passes to the stomach, which mixes with the stomach acid. It forms something called as chyme, and then it goes to your intestine. So there are two intestines we have: small intestine and large intestine. Now maximum nutrients are absorbed in from our intestines, right? And then whatever is remain goes into the large intestine. From there it is excreted out. So the most nutrients will be absorbed from our intestines. Now, if you take a lot of laxatives, and this I'm talking about, not you take once or twice, it is okay. But if there are so many people who need the laxative to pass motions, without which they cannot pass, right? So they are so much habituated with that laxative that without having that, they cannot pass motions. Now, in such scenarios, where the food does not stay for longer time in your intestine, and definitely there will be lot of malabsorption over there, right? So it's very important not to get used to medications. You would rather use food and water to get rid of constipation than going in for medications, because eventually it is going to cause a lot of harm. Now second is antibiotics. Like I gave the example of UTI, right? You have taken a dose of antibiotics for 10 days, then again another dose of antibiotics, or in chronic illnesses where there are a lot of infections that you get and you have to be on antibiotics. So what does antibiotic do? And the word antibiotic means it kills all the bacteria. So the antibiotic does not know what is good bacteria, what is bad bacteria, right? So it will kill both of them. So along with the bad bacteria, your good bacteria also gets killed, and because of which your gut does not have the good bacteria. Now this bacteria is needed for nutrient absorption. It helps the food, the nutrients come out of the food and go into the body. So if that is not there, definitely there is compromised nutrient absorption. Along with that, also B vitamins are lost. Okay. Now, because these B vitamins are lost, what happens is, for every food to be digested in our body, it needs B vitamins. Without B vitamins, they cannot do that. So the food again doesn't get absorbed properly. So ultimate result is that you're not only losing your good bacteria, you're also losing a lot of nutrients. And that is why, when you use a lot of antibiotics, right, you lose your appetite. You oftentimes have stomach issues, right? You may have loose motions, you may have constipation, you don't feel good, you feel very lethargic, tired. And B vitamins are our stress vitamins. If you lose that, you start feeling very tired, weak. So all of this comes as a side effect when you're using a lot of antibiotics, right? Also, when you lose B vitamins, you have skin issues, you have intestinal problems, you have nervous system problems, because B vitamins are also related to our nerves. So you start feeling depressed, anxious. There are a lot of issues that come across. The third one that we talk about is antacids. Again, antacids, you eat outside, you have eaten a very heavy food. Many of you have this habit of breaking a packet of Eno and putting it in the water and using it to take care of your acidity issues. Now, the problem is in the food per se, but you're using a medication to take care of that. So you're finding a solution by taking an ENO, and you feel better after it because you burp and you feel better. So yes, it is a temporary solution, but overuse of this, what happens is ENO, or whether it's Alka-Seltzer or any of these tablets that you dissolve, it is made up of sodium bicarbonate or sodium carbonate. So it is a salt of sodium. Now, when you take that, what the body does is it lowers your potassium levels, and there is another B vitamin called as folic acid. So if you keep on taking this over and over again, potassium, folic acid, you will lose within the process. And what happens because of that, when you lose potassium, you start getting these jitters, you start feeling tired, you start feeling a lot of water retention in the body, you get palpitations, and also folic acid can lead to a lot of weakness and tiredness, right? So again, antacids give a temporary solution at that point, but it leads to a lot of nutrient deficiencies. The fourth category is anti-inflammatory drugs. For example, steroids, right? Lot of times, if you have illnesses, and most often when there is a lot of pain which cannot be cured with over-the-counter drugs like painkillers, oftentimes you are prescribed steroids. Now, steroids is one category of drugs which gives an instant solution, or which takes away your pain instantaneously, but it is one category of drugs which can cause a lot of deficiencies in your body, and you can name it. Those all vitamins and minerals are lost, especially our antioxidants, our fighters of the body, the vitamin A, the vitamin C, the vitamin D, selenium, zinc, calcium. It leads to, it decreases the absorption of all these. These are the few that I have listed over here, but there are definitely a lot more. So if you have steroids for a very long time, it leads to a lot of muscle wastage, eye issues, your immune system is weakened, your bones become brittle, there is iron deficiency, your brain gets affected, you are at a risk of many illnesses like cardiovascular disease, cancer, other lot of neurological issues, right? So overuse of steroids can lead to multiple deficiencies, right? So these are medications which should be followed strictly as how the doctor has told. Many times people abuse it because they get good results, and they feel much better, so they abuse it. So be very careful if you're taking these drugs. Go as per your doctor's advice only, okay? And the last one that I want to talk about when we talk about medications is oral contraceptive drugs. Again, these oral contraceptive drugs are, or the contraceptive pills, oftentimes women in their teenage years, start in their teenage years and in their mid years, right? So if you take lots of cycles of these OCPs, and you take it for a prolonged time, it can also decrease levels of a lot of vitamins, specifically vitamin B, C, and E. Again, the antioxidants are lost, as well as magnesium and zinc. Okay, so whenever you lose like antioxidants, your immune system is weakened. Okay, that is the first thing. If you lose zinc, so zinc is related to our nerves and also to your PMS. So even when you're taking oral contraceptive pills, you have a lot of symptoms of PMS. You will have a lot of aches and pains. Maybe your menstrual cycle is very heavy or low. You will have a lot of irritability, acne, all of this. And also OCPs also can lead to premature aging as well, because you're losing a lot of antioxidants which are related, which preserve all that in your body, right? Plus your mental issues as well. There is a lot of depression, anxiety, and nervousness. So you may not relate to the oral contraceptive pills, but indirectly, what happens is abuse of medications will lead to deficiencies, which will then give rise to these symptoms. Many times we don't associate, we think it is because of the medication. It's not because of the medication per se, but because of the deficiencies that occur, which can give rise to these problems. Okay. So that was poor absorption. Now, some medications can also slow down some nutrient production in our body. Like, for example, when we take a lot of antibiotics, I said it kills the good bacteria as well as the bad bacteria, right? So what happens is when the good bacteria is killed, this good bacteria produces vitamin K in our body. Now, when that is killed, our body cannot produce vitamin K efficiently, and it can cause lower the production of that nutrient, right? Similarly, some of the medications can also throw out some nutrients out of our body. For example, diuretics. What are diuretics? Diuretics are either given when you have kidney problems, where you don't generate a lot of urine or excrete. So to increase the flow of urine, diuretics are given. Many people also use diuretics to lose weight. When you have a lot of weight, they are prescribed diuretics. When you take diuretics, you start losing a lot of water, and you will see a reduction on the scale and you feel good about it. Well, it's not as easy as that. If you use diuretics for a very long time, along with the fluid which is excreted by the kidney, you're also losing electrolytes. So you're losing electrolytes, which is sodium and potassium. Sodium is easily replaceable because we eat salt. But when you lose a lot of potassium, potassium is needed for your heart, right? And as well as for your muscles. So when you start losing potassium, you start feeling tired, weak, you may have palpitations, you have muscle loss also. So your body aches are there, you just don't feel good, right? Plus there may be water retention instead of losing over a period of time, and eventually it is not going to really help you, right? So this was about the effect of common medications. There are a lot of other medications, but I am not really qualified to talk about those medications, specific medications for epilepsy, for heart disease and all. So I think I just took the ones which are very commonly used without prescriptions, right? So let's talk about some food interactions with the drugs. Okay. So the first one I want to talk about is the hypothyroid drugs. You are always, whenever you are diagnosed with hypothyroidism, or thyroid as it is commonly called, you are supposed to take thyroid medicine, which is levothyroxine, on an empty stomach. Your doctor will always tell you that you should take it on an empty stomach. So is it true? Yes, it is. Why? Because when you take it with food, or anytime it is eaten with something, there are these nutrients present in food like calcium, iron, and many other nutrients. These will not let that thyroid hormone be absorbed properly, and that is why it may not really give results. In fact, the latest study which was done was, if someone took this Thyronorm or along with breakfast, and check the TSH after say 3 months, the TSH remained constant. It did not decrease. Ideally, with the Thyronorm, your TSH should go down to the level so that your body can function properly. So that is why always take your thyroid medication when you wake up, and keep a gap of at least 30 to 60 minutes before eating something, right? So always remember that thyroid medication should be taken away from food only when you wake up, right? So then second is certain antibiotics, right? A lot of antibiotics interact with calcium. So a lot of and specifically the calcium which is found in dairy, right? Whether it's milk, buttermilk, yogurt, cheese. So certain antibiotics, the typical ones that I can name is the Ciplox or the Doxy, which we are commonly given for bacterial infections, respiratory infections, UTIs, and common infections which are there. So when you have these medications with milk, we are oftentimes we are told that acidity nahi hogi, so you should have your medicine with milk. Please don't do that unless your doctor has suggested you, because the calcium in that dairy can bind to this antibiotic, and the body will not absorb enough antibiotic that it needs, so it will not give you the result, right? So it is always better to keep a gap of 1 to 2 hours before taking these medications, unless your doctor has told you to take it with milk. So don't go against the words of your physician, because many times we try to take things in our hands and try to, because I'm acidic, let me take it with milk, it doesn't matter. So please don't do that, right? Follow the instructions properly, then only you're getting the best out of what medication you're taking. Then there is a common drug which is given for depression. So the common names that I can suggest are the ones here: Marplan or Panate. So these are again given by on a doctor's prescription, not to be taken on your own. But if you are on antidepressants, usually you should avoid having that glass of wine or having some cheese or something with it, because it contains a chemical which is called as tyramine, and this interacts with the medication and it can actually raise your pressure very, very high, and it can be fatal, right? So again, if you are on antidepressants, please listen and do not take things in your hand and eat anything with it. So it is always good to stick to your instructions and read your instructions before you take such medicines. Then often, so the most common medication which we usually is prescribed are for cholesterol or for blood pressure or heart problems. So there are these set of 4 medications which are often given by the doctors. These are called as calcium channel blocker or statins. So again, these are medications which are given to control your cholesterol and pressure, and so that to prevent your heart attack. Now, these medications usually do not take it with grapefruit juice, okay? Because there is an enzyme in grapefruit juice which does not break down this drug very properly and lets it stay in your blood, and the side effects are very complicated. It can actually trigger a lot of heart issues in that scenario, right? So do not take blood pressure or cholesterol medications with grapefruit juice. Then blood thinners. So typically, again, there is a blood thinner. Commonly, aspirin is given to those who have heart issues. You're supposed to take aspirin every day. And also a lot of people are there on blood thinners, or those who are epileptic also take blood thinners, or those who have a lot of blood clots. So oftentimes what happens here is, this is an important one to understand, is I think most people know, or you are usually told that, don't eat leafy greens if you're on blood thinners. The important point to note here is you should not completely avoid vitamin K. This is what people understand, that since I'm on blood thinners, I'm not supposed to eat any spinach, any methi, any kale. It is, what people do is, suppose now it's winters and there is a lot of green leafy vegetables in season, so every day in all your meals you eat a lot of spinach, methi, green leafy vegetables, and then you completely stop eating it, right? So this up and down in the amount of vitamin K that you take is the problem, which leads to a lot of bleeding or to blood clots, these extremes which happen when you take vitamin K and blood thinners. So what you are supposed to do here is, if you are on aspirin, you're on blood thinners, you can eat your spinach, you can eat your greens, but the level has to be maintained. For example, you eat it once or twice a week, or you eat, say, 1 katori of dal, palak dal, or methi ka paratha in a day. It is absolutely okay. You just don't change the frequency or the amounts of green leafy vegetables every day, which is going to cause a problem. So I hope this is clear. This is something very commonly which we as dietitians are asked: should we avoid all leafy greens because we are on blood thinners, right? Or because your physician has told you. But you need to understand that this is what your physician meant. Don't do excess or don't completely avoid it. Maintain a constant amount of leafy greens, right? Uh, then comes your common pain relieving drugs, right? So typically, uh, there are three things that I'll talk about alcohol here. Like I said previously, also, alcohol is one of the main things which has the maximum interactions with drugs, right? So oftentimes we take it very lightly, and you're like, it's okay, let me have my alcohol and it's okay, and then you suddenly get that headache and then you pop in your painkillers. Well, you have to be very careful when you do that, especially if you drink on a regular basis and you're taking more than 3 drinks every day. So that means you are a chronic alcoholic. Then you should not be popping painkillers when you are that high with alcohol, because what happens here is the liver is unable to throw out the drug out of your body, and it can hold a large amount of toxins, the alcohol toxins as well as the drug toxins, and it can lead to liver toxicity or liver damage, right? So higher chances of your liver getting damaged if you're using this combination um, for a longer period of time. Similarly, there are other cough allergy. You have these allergic coughs, and you have these cough syrups like Benadryl, Corex, and all, right? So these have antihistamines in them, which kind of take your allergies down and also control the cough. These also should not be taken with alcohol. So in fact, there is this phases where people want to get high and they drink these cough syrups and everything, because these antihistamines can relax your body and can promote sleep. That is what takes care of the symptoms. Now, when you have this with alcohol, it is going to increase your drowsiness, and it can be, again, it can lead to a lot of damage to your brain, right? And also, a lot of medications do state, do not drink and drive, or do not drive when you take these medications, right? So that is the reason, because it's going to take it up a notch and it can lead to a lot of drowsiness. uh, then the drugs that we have for diabetes, right? Whether it's metformin or you are taking insulin, these also react with alcohol. Again, having said that, there are a lot of diabetics out there, and you will say that, should I not drink the alcohol at all? Well, it's not that way. It's everything has to be in moderation. I'm talking over about these interactions. If you're having if you're a regular drinker with having 2 to 3 drinks every day, then this is more pronounced, right? So if you are having oral diabetic medications, what happens is, when you have alcohol along with this, again, what happens is, alcohol is in the liver, where it's trying to reduce its toxicity, and you take the diabetic medication at the same time, the liver is unable to concentrate on the sugar levels. And when this happens, the sugar can go drop down. So if you are taking medicine and consuming alcohol, it can go dangerously low, and it can go low and can lead to fatal issues. So it can start with drowsiness, dizziness, you have sudden heart palpitation, anxiety, but it can also lead to toxicity in your body, right? So it can be fatal. So for diabetics, usually, you always ensure that you're eating some food if you're taking alcohol, and do not take your diabetic medication also on an empty stomach, and do not try to keep the timings at the same time. So following certain guidelines about diet for a diabetic is going to ensure that you don't go into toxicity. And if you are taking insulin, then it both can happen. Again, the liver is confused in this state, whether uh, it's going to break down the alcohol, or it is going to work on the glucose. So if you put insulin, it kind of doesn't know what to do. Sometimes the sugar levels can shoot up, and sometimes the sugar levels can drop down drastically. So hypoglycemia can also occur, and hyperglycemia can also occur. And it all depends on the amount of alcohol you're consuming. If there is too much, it can lead to lower. And if it is little and there is a lot of insulin, it is going to show a different result. So all the diabetics, if you're taking alcohol, please ensure that you're having enough food with it and you're eating regularly, and you see the dosage of your insulin and your drug, and accordingly you may need to modulate it, or you need to inform your physician that this is what I have, so they can tell you the exact dosage of your drug, right? So that it doesn't cause these side effects. So we spoke about medications, right? And we spoke about the food effect on medications as well as the medication effects on food. Now let's talk a little bit about supplements, right? When we take a lot of supplements, for example, multivitamins or calcium or iron, what happens is sometimes these nutrients, if you take them, if you take it in excess amounts, they actually act as medications in your body instead of nutrients, right? So also what happens is sometimes these nutrients, if you take excess, they can interact with other nutrients and they can actually be bad for you. So many times we often say, do not self supplement yourself. So many people out there will just self supplement, like, okay, B12 is very good for you. You don't get your B12 levels checked and you start supplementing yourself with B12. You go on and don't stop it. Or some people take multivitamins forever, when as well as have some good intake of those in food. Or there are multiple supplements out there which don't need prescription, right? So you don't need a prescription, you can order it and you can just go on eating it. And that is where the damage occurs, because it can cause deficiencies. So like for examples that I've given here, if you're taking a lot of multivitamin, or say, now because immunity is in everybody's mind and they say zinc is very good for immunity, you will self medicate and have keep on having zinc supplement. If you take too much of zinc, it will affect copper and iron absorption. So in fact, doing better for immunity, you are actually taking iron out of your body, and it can lead to low hemoglobin or low or anemia in the process, right? Similarly, if you are absolutely fine and because you feel, you want to increase your iron and you take iron supplements, or you're having hair fall and somebody said that iron is good for you, you start eating iron, it can on the opposite side lower your zinc. And when zinc goes down, it affects your nerves, it affects your wound healing, it affects your immunity. So a moral of the story, again repeating the same thing, do not self medicate yourself just because anyone else is doing it, or because you just feel that it's there out, somebody has told that this is good for you, means you start taking it and you don't stop taking it, right? You keep on taking it, and do not discontinue it after a period of time, after you don't need it also, right? There are also a lot of nutrients which work together. Like if you take one nutrient, it helps other nutrient, or there are certain nutrients which if you take together, you get the best benefits out of it. Just like a concert, right? You have multiple organ instruments which are being played, and it gives result to a perfect harmony. Same way, there are some nutrients which work in harmony to give you the best results. So let's talk about a few of them. The first and the classic example is vitamin C and iron, right? So there are two types of iron which are available from food. One is called as the heme iron and the other is called as non-heme iron. Now, heme iron is the one which is found in animal foods like red meats, fish, and dairy. All of these have the heme iron. Now, this heme iron, if you eat, it is absorbed very quickly in your body, and body doesn't need anything for it to be absorbed, right? It gets absorbed very quickly. Now, on the other side, the non-heme iron or the vegetarian iron is not absorbed as easily. It needs vitamin C for our body to absorb it better, right? So, if you are having iron, if you're having iron rich foods, ensure that you're having vitamin C along with it. So, where do you find them? Vitamin C is found in all citrus fruits. It's found in broccoli, leafy greens, colored peppers, strawberries, tomatoes, anything which is khatta or sour, right? Guava, chilies. Iron sources, of course, red meats and dairy, fish. But along with that, vegetarian sources are rajma, kidney beans, then also the ragi, sesame seeds, lentils or dals, then green leafy vegetables. So these are all, and dry fruits like figs and apricots and dates, right? So all of these are good sources of iron. So to get the maximum out of these, ensure that you're adding some amount of vitamin C with that. So how, the couple of examples that I've given here, maybe you're stir frying your vegetables. If you're stir frying spinach or broccoli, or ensure that you add some colored peppers to it or some tomatoes to it, right? If you're making your rajma chana, do add in some chilies, some tomatoes to it. If you're making some salad with a lot of leafy greens like lettuce and all, ensure that you add some lemon or some orange to it. And if you're having some cereal like oats or something, you can add in some berries or blueberries or strawberries, right? So you're getting the best out of your food by making. And if you're making, say, dry fruits, if you're eating, you can also add in, along with the dry fruits, you can add in some berries as well, so that you ensure that your iron, you're getting the best iron out of the food that you're eating. The second synergic relationship which is there is amongst the B vitamins. So there are three B vitamins which work very well together: the B6, B12, and folic acid. In fact, this trio of B vitamins is very helpful in many situations. People who have heredity, or who have a risk of heart disease or their heart, and usually when you get your heart profile checked, there is a test which is called as homocysteine. If their homocysteine levels are high, you are at a risk of heart disease, right? So to control that, these three vitamins really help. Now, along with the heart, functioning of the heart, these three B vitamins are great for your brain, are great for your nerves. In fact, if you're having constant back pain or a lot of other pains in your body, many a times the trio of these three vitamins gives much better results than you taking individual of these, right? So many times when you have a lot of stress or your brain is affected, or usually you have a lot of back pain, you usually get your blood test done and you're told to check your B12, and usually the B12 always comes low, and then you're put on B12 medication. So B12, and you don't, many a times you will see results, many a times your pains don't really go. So instead of focusing only on one of the nutrient, if you take all three together, you're going to definitely see a better result and a positive result, right? So where are the sources of these three? Well, B6 is found in usually whole grains, so whether it's brown rice or whole wheat or oats, barley. Then also in your dals, chana, rajma also is found in lean meats like chicken, also found in nuts, specifically pistachios, sunflower seeds. B12, vegetarian sources are very less. The biggest source of vegetarian one is nutritional yeast, but definitely found in a lot of animal foods like beef, fish, seafood, chicken, all of these. But for vegetarians, B12 usually needs good amount of probiotics, so, and also whole foods with wheat germ, so that these help your body to produce your own B12. But nutritional yeast is something which is definitely going to help for vegetarians to increase the amount of B12 in the body. And folic acid is typically found again in lot of cereals, whole grains, in soybeans, in green leafy vegetables, in avocado, in also in dark colored vegetables, berries. Right. So if you want to get the best out of these three, how you can do it is, if you're making, say, broken wheat upma or an oats upma, you can add in some spinach to it. You are making pasta, spinach pasta or pesto pasta, you can make, you can sprinkle some nutritional yeast, right? You can also add in some broccoli along with it. You can make your chana rajma to your dishes, and instead of adding some cheese, you can add in some nutritional yeast. Or for example, an Indian dish like brown rice soya pulao, you can make and you can add in some palak to it, or you can have it with a palak curry, or you can have some rice with soya palak or something like that. So you can make these combinations of these foods so that you can get all three together, and it can really help you. The third one is calcium, vitamin D, and vitamin K. Now, we are always told, right, calcium is good for our bones. Like, you need to have your milk, you need to eat your calcium, then only your bones will be good. But how many of you know that for that calcium to build the bones, you need two vitamins, vitamin D and vitamin K, right? Without these two vitamins, your calcium will not be able to build strong bones, right? So vitamin K is like the traffic police. It will tell where the calcium has to go, whether it has to go to the bones or it has to go to the calcium level. So it will tell where exactly it has to go, so that, you know, it is not built up in one particular place, right? Similarly, vitamin D is needed for the absorption of calcium. Without vitamin D, your calcium cannot be absorbed. So many times, you know, when you have these pains, when you have these bones which are paining, or you're getting frequent fractures and all, you are always put on a supplement of vitamin D, and you're told to check your vitamin D, because it can be that because you're deficient in vitamin D, you are not being able to the calcium is not being able to stored in the body, right? So these three need to be together for you to have good bones. Calcium, all of us know, one main thing is dairy, but apart from dairy, there are a lot of other foods which have calcium: nuts, almonds, walnuts. Then there is rajgira or amaranth. Again, your beans, your kidney beans, navy beans, any of these beans. In fishes like salmon, sardines, ragi, I said, sesame seed, great source of calcium. Tofu, all of these are excellent sources of calcium, even if you don't have dairy, right? Vitamin D, again, sources of food are very less. If you are an egg eater, eat it with the yolk, which has got good amount of vitamin D, or mushrooms have it, or some fortified milk will have it. Otherwise, sunlight is the best answer for vitamin D. And do regularly check up your vitamin D at least once a year, so that you're not deficient and you can take supplement for it. And especially after your 40s, right? If you're taking a calcium supplement, ensure that you are also testing your vitamin D. Vitamin K found in all leafy greens, in broccoli, in soybeans. So having at least 3 to 4 times a week of leafy greens is, I think, the nature's best multivitamin. If you've seen so many examples I've given where I've spoken about leafy greens and the amount of nutrients they have, right? So why don't we utilize these beans, these greens, which are so good powerhouse of all the nutrients and which help our nutrients to work in synergy. So how do you use all three of them? You can make omelets, adding spinach to it, mushrooms to it. You can add some milk to it, or cheese is often added. You can add some feta cheese. You can sprinkle some paneer in it, or classic palak paneer or palak tofu. You can make smoothies with nuts and milk. You can add in some greens to it, right? So these are great ways where you can get all the three nutrients. And the last one that I'm going to talk about, the synergy one, is potassium, magnesium, and calcium. Calcium not only works with vitamin D, but calcium also is needed for our nerves and for blood pressure, right? So these three nutrients often work well together. In fact, studies, a recent study which was in 2015, it was a big study where they found that men who were eating good amount of all these three nutrients, magnesium, potassium, and calcium, had 20% lower risk of getting stroke than they taking only one of each, right? So when all three you take together from food, you are definitely keeping your heart, you're keeping your blood pressure in control, and you're also keeping your brain in control, right? So how do you get all three of them? Well, potassium, the best is banana, along with again beans, right? And also milk, nuts, right? Magnesium is found in, again, almonds is a great source of magnesium, in potato skin, in whole grains, in leafy greens, and also in seeds. Calcium, we've already spoken about it, right? So how do you mix all three? Probably you can make an oatmeal, you can add in some bananas to it, some nuts and raisins to it. You can make some bean salad, you can add in some leafy greens to it. You can make a ragi roti, and you can make some palak chana and curd with it, right? Or a smoothie is also a great way where you can incorporate all of these together. We spoke about which nutrients work well together. There are a couple of nutrients which work against each other. And this is also one very important thing. Why do we nutritionists always say that salt is not good, excess salt is not good? Well, sodium, if you take too much of sodium, it throws out your calcium from the body. So it leads to removal of calcium. So people who eat a lot of junk food with a lot of salt, not only do you lose a lot of water, there is electrolyte imbalance and affects your heart, increases your blood pressure, but it also depletes calcium from the body. You are at a risk of osteoporosis and osteoarthritis as well, because your calcium is also excreted, right? So very important and very interesting to know that, salt can affect calcium. Similarly, I think zinc we already spoke about. Zinc affects your iron. Zinc also affects magnesium. And also calcium and iron don't really work well together. So if you're someone who's been diagnosed with anemia or something and you're taking iron supplements, don't have it with milk. So typically the best way is take your iron supplement when you wake up or when you go to sleep. Don't have near food. Keep at least 1 or 2 hours of gap. So now to sum it up, we spoke about different medications, different foods, different nutrients, and different interactions, and kind of is daunting. It can be intimidating, like, how do we avoid all this, right? Like I said, for a normal person, the side effects or the deficiencies may not be pronounced if you are taking good precautions. But if you are abusing nutrients, abusing medications, or following a lifestyle where you have poor nutrient intake or you have chronic illnesses, then you are definitely at a risk of nutrient deficiencies and a lot of side effects. But along with that, there are a couple of points that I would want to sum it up as how you can lower the risk is, first and foremost and very important, is eat a healthy diet. Do not use supplement in place of food, right? Food has a role in your diet and it can never replace a supplement. A supplement is a supplement, not a replacement, right? So your first and foremost way to go is eating a healthy diet. You eat all the food groups. In fact, over and over again, I spoke about beans, I spoke about milk, I spoke about nuts and seeds, leafy greens, citrus fruits, berries, right? So these are foods which are powerful in a lot of nutrients. And by including all of these, you're getting the needed nutrients in your diet. And these nutrients will help you tackle the side effects of medications naturally, right? Second thing is, if you are taking any medications, whether it's prescription or the counter, do not forget to check the directions, right? Do stick to it. There is a reason why they are given. Do not ignore those, right? And also do check the warning labels. You never know when it is going to affect you, right? Do not take any supplements, any medications because someone else is taking it. Do not self medicate, right? Always check with a practitioner, check with the concerned person before you self medicate. Do not abuse over the counter medications frequently as a solution, because they will just take care of the symptom for the time being. It will not take care of uh, the underlying issues which can arise because of abuse of those medications. Okay. And always tell your doctor about everything else that you take, whether it is alcohol, whether you're taking any herbs, because a lot of herbs, I didn't go into that today, but there are a lot of herbs which counter react medication, right? Or even if you're taking painkillers, antacids, you have something, always inform your physician about it so that they can give you the necessary precautions, right? And if you are taking any medication, do not hide the symptoms from your pharmacist or your physician. If it is something new or unidentified, you definitely are going to highlight it to your physician. Always keep the list of medications that you use so that you know which one you are taking, which one is for what, so that you are aware, because being aware yourself instead of depending on someone else is not going to help you, right? You need to know which medication you are taking, for what you are taking. Always be aware. It's okay to question your doctor, your physician, why you're taking a particular medication, right? And any questions, do not hesitate to go to your pharmacist or a physician. And if it is related to nutrition, always consult a nutritionist or a dietitian rather than self-medicating or self-supplementing yourself, right? With this, I'm done with the topic for today. And moderator, you can open up for questions. Hi, Adita. Is electrol powder good to have once a week? Electrol is basically giving you electrolytes. Instead of going in for electrol, you can get the same electrolytes from food, sodium, potassium, everything. So your electrolytes are majorly present in fruits. So eating fruits is naturally going to give you the electrolytes. Um, uh, can you have session on foods like cardio, hair issues, skin issues? Oh, there are a lot of topics for sure. We'll keep that in mind and definitely consider those. How good is Leaf 52? I take it for liver detox. Again, Sheetal, if Leaf 52 you have self-medicated yourself, then probably you shouldn't do so. Liver is one organ which is naturally there in our body to detox. It doesn't need any support to detox. If your liver is healthy, it can naturally detox without any support. So you can keep your liver healthy by eating a lot of leafy greens, drinking a lot of water, apple cider vinegar, lemon, and then avoiding a lot of fatty and fried food is going to keep your liver healthy. Liver gets abused when you take a lot of artificial things like medicines, drugs, alcohol, anything which releases byproducts, which are, or colors, additives in food. All of this can harm the liver, and especially the trans fatty acids. So if you're away from all of this, your liver has the ability to do it by itself. What precautions to be taken with protein supplements? With protein supplements, the biggest precaution is water, because protein residues can stay in the stomach and can affect for a longer period of time in excretion. So it can affect your liver and kidney only in extreme cases where you're absolutely not drinking water. As long as you're drinking enough water to flush out the residues, you're absolutely okay. How many days we have to take spinach? You can eat spinach every day if you're not having any thyroid issue or any issues with your kidneys. Otherwise, or if you're on blood thinners, Like I said, you can eat spinach in the same amount. Don't eat too much or eat too less, which is what is going to cause an issue. Is there any expiry date for dals and pulses? Well, technically no, but dals and pulses can get infested with germs. In that scenario, you probably need to keep a watch whether it's infested. But if you keep in a dry environment, it can stay for at least a year for sure. Ideally, always buy enough so that it doesn't go beyond a year. That is a great way. Is iodized salt good for thyroidism? Yes, iodine is needed for thyroid function. So, iodized salt would definitely be advised. Will 2 cups of coffee in empty stomach 2 times good for health? Well, coffee on an empty stomach can be dehydrating. So, I would suggest when you wake up, have a glass of water, have some nuts or a fruit, which is going to give the needed nutrients. And then after some time, you can have your cup of coffee, 2 cups of coffee in a day. Absolutely okay, as long as you don't have it with food. I forgot to mention this, but the caffeine in tea and coffee also interfere with the absorption of calcium and iron in the body. So try not to have your tea and coffee with breakfast or with any food. Keep it away, have it alone by themselves. That is a good way. Um, uh, what care to be taken for Parkinson's? That is a very specific question. I think, and that is probably should be better answered separately. Is isabgol fine for constipation relief? Isabgol has got psyllium husk, which is a soluble fiber. When you take isabgol with water, it forms a gel, and that helps get rid of constipation. But what happens is it does give you relief, but it is very addictive. So what happens is if you depend on isabgol and you keep having it every day, the body, the muscles of the intestine stop working on their own. Technically, when we eat food, that is when our digestion starts. So it starts right there, and by eating that food, we are triggering all the release of enzymes, and that usually happens by eating fiber. And naturally, the body will release those enzymes and help throw out the food from our fecal matter. So you would rather depend on vegetables, fruits, whole grains, along with good amount of water intake to relieve your constipation than depending on isabgol, which is going to not going to help in the long run. What vegetables and fruit should be taken for thyroid? All vegetables and fruit, in fact, cruciferous vegetables like broccoli, cabbage, cauliflower, spinach should not be taken raw. You need to cook them and take them because they interfere with high thyroid hormone production. But apart from that, you can take any other fruits and vegetables. Can I take supplements like ashwagandha? Yes, if you are having, see, any supplements like ashwagandha is there needed for a lot of, for your brain function, for your reproductive function, for energy. If you take supplements, like I said, it's a supplement, right? It's not a replacement for food. You can take it for some time and get off it. Don't continue it so that your body starts depending on it and does not work without it. Even if you're taking multivitamins or any of these supplements, take it for some time, then take a break and see if your body is functioning well on its own, and then go to food sources. If it doesn't, then you can get back to it whenever needed, but don't get habituated to it. So yes, multivitamin supplements. If see, there are a lot of there are a lot of things about multivitamin supplements. The vitamins and minerals are better absorbed in certain forms. For example, calcium is best absorbed in a citrate form. Magnesium is absorbed in a citrate form. Similarly, there are a lot of vitamins which are absorbed in a certain form. So if you're taking a multivitamin supplement, and if you're taking a cheap one, usually they add in these nutrients in a form which may not be absorbed by the body. And all you do is you're just popping that pill and it just goes out of your body unabsorbed. In fact, when you take a supplement, there is not 100% absorption, which is always there. It also depends on how your body is and what situation your body is in, that it will absorb those nutrients. So having said that, your first line of action is try to get it from food. If in case you're not getting it from food and you want to add in a replacement, you can add in these multivitamins, but don't compromise on the quality. Do go in for good quality ones, and do take suggestion from the nutritionist or pharmacist as to which is a good one. What can be the reasons of excessive dryness? There could be multiple reasons. If it is your palms, it could be an allergic reaction to the soap or detergent. But if it is your overall skin has got multiple nutrients which it needs. It needs your good fats, it needs vitamins, it needs water, it needs a lot of so basically, to have a good skin also, you need vitamin C, you need water, you need vitamin D, you need omega fats. There are a lot of vitamins which are needed. So the reason could be also as simple as water intake. You're not having enough water, or it could be any of the deficiencies, and also B vitamins. I take Tylenol and cholesterol tablets. Is it okay to take them after taking alcohol? Tylenol is taken early in the morning on empty stomach, which doesn't really matter. Alcohol, you take it later in the day, it doesn't really interact. The cholesterol ones, yes, like I said, food is very important. And I think cholesterol medications are also taken post breakfast. So again, if you're taking alcohol in limited amounts, not every day, it shouldn't be an issue. Is it okay to avoid supplements suggested by physician and try to fill up with diet change? Well, if your physician has suggested, it could be for a reason, and there are certain supplements which may be needed because you're having certain symptoms, right? The deficiencies could lead to deficiencies of supplements could lead to multiple deficiencies, which can lead to multiple symptoms related to your heart, your brain, your nervous system, your skin. So I would never suggest, like, do not go against your physician's orders. You would definitely want to stick to it unless it is something which you absolutely don't need, or your physician is just helping you get it because you're not having from food. Then you would rather want to check with your physician before you stop taking it. Can we take collagen powder once a day? Well, collagen is a good supplement. Collagen is needed for your skin, for your bone health. It is a good supplement. Again, don't depend on it. Uh, is it okay to take snacks with milk tea? I would suggest do not have tea with any food. You would want to eat your snacks and then 15 minutes or half an hour after you take your tea. Um, what is the best time to have vitamin D and multivitamins? Most of the vitamins should be taken with food. If it's fat soluble vitamin like vitamin D, it needs something with fat. So either milk or nuts or eggs. And if it is a multivitamin, usually which has got a mix of both water soluble and fat soluble vitamins, so you take it after breakfast. It is a good one. Is taking whey protein safe as long as you keep a good watch on your water intake and you're taking whey protein because you're exercising or because you're not meeting your protein intake, is when it is okay. If you're getting your needs through food, there is absolutely no need to take the whey protein. Isabgol, I think I answered. Apple cider for weight loss. Well, apple cider alone is not going to help you with weight loss. Apple cider can boost your metabolism, can help in good digestion. So it can be used as a support mechanism, but definitely not the only thing. A good diet with good exercise and will definitely be needed. Can we drink haldi milk if we have asthma and ILD? Does milk increase cough? Milk does increase mucus production. So if you're taking haldi milk, add in pepper with it, and haldi and pepper in milk definitely is a good combination to lower. You can also add some grated ginger to it, which can loosen up the mucus. So that is a good way to have. What should be a gap between normal meal and BP medication? I think BP medication is okay to have post meals, and usually you are advised to take it post your breakfast, so that should be okay. Um, uh, okay. I've been taking antidepressant for years. My vitamin D was very low, so started taking fish liver oil. Is fish liver oil okay, or should I ask my psychiatrist? I think fish liver oil is in itself an anti-inflammatory, so it does help. But for vitamin D, I would suggest you would need pure vitamin D. So it's good if how low it is. If it is extremely low, you would need a high dose of supplementation for 12 weeks or so to get the stores. And in fact, low levels of vitamin D can affect your antidepressant as well. So it's good to ask your psychiatrist for sure. What food is good for anxiety and depression? Foods rich in B vitamins, foods rich in omega-3 fats, um, nuts, seeds, and also whole foods. These are definitely the things which help in keeping your brain in a better shape. Um, okay. I am taking up specific questions. Because there are a lot of questions. I am feeding my mother. I'm a feeding mother. I'm taking calcium supplement for 1 month. Oziva, is it okay? Feeding mother, I think uh, you can easily get calcium from sesame seeds, from nuts and seeds with milk. You really, unless your doctor has not advised it, I would definitely not want you to take a supplement. Mm. Is it okay to take multivitamins for osteoarthritis? Osteoarthritis is multivitamin may not give you the adequate nutrients in the adequate amount. Multivitamin may give you enough RDA for a normal person. Multivitamin is for a normal person. For specific conditions, you need specific nutrients. So definitely you would want to focus on those nutrients. Arthritis is anti-inflammatory, so you would want to focus on that. Plus it's related to your bones. So vitamin D, calcium is something, magnesium, these are the ones that you would need to focus on. Again, that needs to be suggested depending on your age, the amount of blood tests that show how much your BMD is. So yeah, couple of tests that you need to do and then supplement yourself. The iron from plant food is different to absorb and need something. Is that vitamin C? Yes, it is vitamin C. So having tomatoes, peppers, to your leafy greens, to your chana rajma, orange juice with your breakfast. All of these are things that usually we have been following traditionally, which really there is a reason why we do that. During my second pregnancy, I was prescribed blood thinners throughout the pregnancy. Post 4 years, I still get blood clots on the first 3 days during periods. Is that normal? I think that is something. I guess also I'm anemic and low on vitamin D. Well, I think this is more, you would want to consult a gynac for this regarding the blood clots. But yeah, anemia, you would want to focus on good iron rich foods, and vitamin D, please take your supplementation because food sources are not there, and do consult a gynac for that. Milk thistle for liver detox. If your liver is compromised, if you are living a very hectic lifestyle where आपके liver को बहुत तकलीफ है, तभी then you would want to go with milk thistle. If you're leading a normal life without liver issues, if you have been diagnosed with fatty liver or something, then you would want to go in for a supplementation. Is spinach bad for thyroid? if you ask me, there is nothing bad for thyroid. I eat my spinach as well. In cooked form, it is absolutely okay, but don't overdo on spinach, like every day eat only spinach, spinach, spinach. You can eat it regularly, like, once a week, twice a week or something. Absolutely okay. But yeah, in cooked form. So if you're having it in smoothies or anything, do parboil it and then have it. Sources of B12 for vegetarians, like I said, very few sources. Whole foods or wheat germ is one. Probably soy milk is there, and then nutritional yeast. But other than that, there are very few sources of B12. You would want to focus on gut health. Give probiotics and prebiotics to your gut to improve the body to make B12 naturally. And if you are diagnosed with very low B12, you would want to go in for supplementation. Uh, mm, okay. Okay, there are a lot of other questions which I am not taking up. Um, do steroids deplete calcium levels? Yes, they do. So when you're taking steroids, and if you, I think you have a specific condition of kidney transplant, do take in the supplements that your doctor would add in, because you would definitely need some supplements to fill up the nutritional deficiencies. Um, Okay, what do you suggest not to eat for people with UTI? Avoid sugar, avoid yeast, avoid drink a lot of water. Definitely a lot of lemon, a lot of buttermilk, a lot of probiotics, garlic. These are good foods, but sugar is number one that you have to avoid when you have UTI, because that definitely affects the bad bacteria feed on that sugar or sweets. I'm on antibiotics now, and I'm having persistent loose motions. You would want to go and add some probiotics. There are probiotics which are there, probably something like VSL or any probiotic, a good dose of probiotic. Go to a pharmacist and do add in a course of probiotics to get the good bacteria back. And uh, now, okay, one or two more questions, and I think we can close it. It's been a year I've been taking heavy antibiotics for sinus. Because of that, I'm facing skin issues and digestion. Yes, like I said, antibiotics do cause a lot of havoc. You would want to cure your gut first. So, gut can be with some good amount of whole foods. You can add some good amount of nuts and seeds. Is something which is going to help you. Give some good prebiotics to the gut, like bananas, apple, garlic, onions, sulfur rich foods. Add in a good amount of probiotics in the form of yogurt, kefir, kombucha, or kanjis, and fix your gut first. Avoid spicy food, avoid sugary food or junk food. Cure your gut, and automatically that is going to then help you with the rest of your body. um okay. uh, Doctor told me not to stop taking the vitamin D after 40. Well, I will never go against the doctor. Probably your doctor is the right person to tell you. So yeah, I cannot say anything on that. Um, okay. Okay, doctor has prescribed me to take omega-3 capsules, Evion, and multivitamins all at the night time. Is it good to take all three? Absolutely okay, because all are vitamins and minerals and they work together. Oftentimes, that is why I always say, right, whole foods are the best, because whole foods work in a complex. They all support each other for absorption. So all our vitamins and minerals, they can be definitely taken together. Um, uh, is okay. Thank you so much for those of you who have said they like the session. Okay. I guess that's about it. I have lots of questions, but I think I've taken up the most related to the topic today. And I hope I was able to clarify a lot of your queries. To wrap it up, food can never replace a supplement. So definitely, food is the priority. If you are having deficiencies, it is okay to take a supplement, but do not let your body get habituated to it. Do not self medicate. Do not take supplements because someone else is taking it. Always read the instructions with a medication. Always follow your um, physician or your dietitian's instructions, and that way you will ensure that you get the best out of the food, out of the medication, out of the nutrients that you are taking, and you will get the best results out of it. So ending this session, and see you again on Thursday, where we have another recipe session, and hope you have a great night, and definitely a great week ahead. Thank you so much.